there. This is Dr. Lynn from Therapy Resources. I have a patient here that recently just had a rotator cuff repair. However, it is with more extensive debridement of the joint on the labral area. So we're really getting a lot of restrictions on the range of motion of that shoulder. So right now, before I do my manual joint mobilization, I would like to do ultrasound on that area so we can let the heat penetrate on the joint so we can get more range, okay? So luckily, she allowed us for you guys to see what we're doing for her therapy today. Thank you. All right, so let's go ahead and set her up. Right, so we have set the ultrasound now at pulse and a 50% duty cycle with 0.8 watts per centimeter, about 1 megahertz. Okay, so we'll be doing this for the next 8-10 minutes. Just right around the shoulder area. Okay, so after we did the ultrasound, now we're gonna do manual manipulation or joint mobilization on the shoulder area and see if we can get a better range. Okay, so let's have her raise the arm up to where she can. Okay, and bring it down nice and slow. Okay, and again up. Okay, and down. All right, now I'm going to do this a little bit of reach there. All right, so we're going to do right there. Let me know how you feel. Try to relax. Feel a better range now. Feel that? It was very limited a while ago before the ultrasound, but now I'm getting more range right there. Does it hurt?
No, it just feels pressure.
Okay. Okay, take a deep breath. Okay, I'll do that. Nice and easy. Try to relax, just let me know. Okay, good. So we did our posterior glide, and now we're going to do a nice inferior glide right there. Although we still have some restriction on moving the arm away from the body, we're still going to glide the joint towards abduction so that when she's ready to do that movement, then she won't have much challenge. Okay, but now we're going to be focusing on posterior glide, in which it will allow her to get more range as she raises the arm forward and upward. So we're doing a little bit of traction and a little bit of oscillation. There you go. About 10 to 15 repetitions of the oscillation, maybe about 3-5 sets. She's tired now. I felt her muscles guarding me now. Okay. All right, now let's go ahead. Nice and easy. Have you move it up. Much range right there. Okay, and then bring it down. Very good. Again, move it up. So you see the difference of the range right there. We're about 90 degrees from about 60-70 degrees. Okay, bring it down. And this time I'm going to help her a little bit. And see if I can go a little bit at 95, right there. It's tight right there now, but at least I got her up to 90. Okay, so it's really good for you guys to adjunct your ultrasound treatment prior to doing mobilization in the shoulder so that you can gain more range and do more strengthening on the muscles at the fullest of its range. So if you have any questions, you can call us here in our clinic and watch more videos in the future. Thank you.